Welcome to Just Picture It. I'm Fung. Tonight our guests will be Valerie and Penny from Samuel Merritt University in Oakland, California. It's a 102-year-old institution that has been educating health professionals for the San Francisco Bay Area and beyond. Valerie Landau is the Director of Student Assessment for Student Learning, and Penny Bamford, PhD, is the Assistant Vice President for Academic Affairs. The question they are addressing is how learning outcomes are relevant to students, faculty, accreditors, employers, and the community. They have found a way to generate dialogue and improvement in this important area of health education by bringing in design, color, and music. Welcome.
Thank you.
Penny, tell us a little bit about Samuel Merritt.
Samuel Merritt is a health sciences institution who's training different disciplines in healthcare, whether it be nursing, podiatric medicine, or podiatry. And a lot of what we're trying to focus on right now are areas that are very important: aging, diversity, and chronic disease.
Well, thank you. I think we have a little sketch of a video rolling of Samuel Merritt. Let's turn to that.
I'm a big runner, and so being a specialist in the foot, I think is very cool. The way clinic works is you get thrown into a room with a patient, work up the patient, you find out why they're there, you do a physical exam, make sure they have proper blood flow to their feet, their nerves are working correctly, check their muscles, everything like that. And then you take all this information that you get and you go and you present it to your attending physician.
What is very special about this particular center is that we have what we call 2 simulation suites, and we have the capability of creating all kinds of clinical environments using mannequins. So we use a lot of mannequin-based simulation. These mannequins are controlled by very sophisticated computer software, so that again we can create a realistic human being in just about any clinical situation that any of our students would find.
It's really great because even though it's not really real patient, but we do IV, we do injections, we do a lot of stuff.
This is a sophisticated 102-year-old university. The simulation is astounding.
We are very proud of it. We're nationally known for our simulation, and it's a way for us to be able to have students practice in a very high-tech environment, which they are doing in hospitals right now. And we also can practice the more compassionate skills, and the students can actually practice all of that within the simulation lab.
It's so interesting to me that you're actually using technology to help the students be able to think about the patient.
It's true. We can simulate anything. Students that are uncomfortable speaking with physicians or uncomfortable speaking with the patients can practice that in the simulation lab and walk away from that feeling much more confident and able to work with the patient a lot better in a hospital or clinic situation.
Oh, that's wonderful. So then how do you actually start to assess whether they're learning the things you want them to learn?
That's been a very interesting process for us. We've been testing students for a long time with different modalities, multiple choice, OSCE exams where they're actually working with a standardized patient, which is the standardized patient is an actor, and they're acting a particular disease or disorder.
An actor?
An actor, really.
Oh, interesting.
And the student gets to assess that client and try to determine through their process what's going on. So the assessment can take on many different forms, but still we wonder, how do we really know? How do we really know what our students know? So we came up with looking at it through the basis of competencies and measurable objectives. Where we can...
Just for our audience,
yes.
Competencies, I mean, that probably means a lot more to you than
yes,
us.
I'm sure
so
it does.
tell us about what objectives, competencies, how does that make sense to me as a patient? How does that help a professional look after me better?
Okay, let's use communication.
Yes.
as a competency. That's something that we think is very important,
Yeah.
that our students are going to be able to communicate with our patients. That would be the competency, and an objective would be that the student is able to assess direct and indirect communication. Like, I could say that, no, I'm not having pain, yet be in a position that's demonstrating excruciating pain. Or just the opposite. I could say, I'm so sad, and why would I be smiling? So there's different cues that the patient expresses that the student can assess and pick up on.
So I think you're touching on a very important point, that assessment can really direct the state of health in a way, that how we train our young professionals truly impacts the delivery of care. And so really you're impacting the delivery of care by the way you assess and what you choose to assess.
Right, right. That's a very profound statement, actually, because Valerie and I have begun to think that the tools actually make the rules when it comes to assessment.
Yes.
That the way you construct a tool or the way you construct the assessment modality in such a way sort of directs the way that you learn, which is a bit backwards from the way that we may have done it before, where the tool shows, which we'll be able to do, the actual content.
Oh, okay. So I know that earlier on Valerie and I were talking, and she has a kind of different kind of background. She's been a pioneer in technology. She's been looking at new ways of doing education. So Valerie, what are you bringing to this kind of tricky problem of curriculum assessment?
Well, I think one of the things that I bring to this is having worked in the field of collective intelligence and really having worked with the idea of visual maps and visual thinking, I was able to, and as well as having a formal background and training in technology and education, I was able to really look at how can we visualize the big picture, the institutional values, so things such as compassion, ethics, and map that with then the more specific goals of each particular academic program, and then right down to the course level where you get into the very detailed course learning outcomes. So
now, that's a lot of stuff. Don't people get mixed up? I mean, how do you keep track of all of that stuff? How does a faculty member keep track? How does a university keep track on whether all the pieces are hanging together?
So this has been traditionally a big problem, and you've seen a lot of other universities getting in big trouble for not being able to track this very well, because it's very difficult.